Hi there. Medications such as blood thinners can lead to amputation. Blood thinners are essentially a medication that allows for the blood not to get coagulated or to be thinned out. And that allows the blood to flow through a blood vessel pretty easily. However, when blood thinners are used too much or too little, it can cause a lot of issues down the line of a limb, such as a finger, a toe, a hand, a foot, or even a leg and an arm. If there is not enough blood thinner, then the blood vessels can actually constrict and the blood cannot supply enough nutrients to that extremity and therefore cut off the circulation. If blood circulation is cut off, then the tissue begins to die off and an amputation is required. If blood thinners are used too much, if it's too much of a dose or too much frequency, then there can be an excessive amount of blood that travels to an area, causing compartment syndrome or pressure in the area, which can then also constrict the particular pieces of tissue in that area and kill it off. Therefore, it is extremely important for doctors, hospitalists, pharmacists to continue to monitor blood thinners as they are given at the hospital or even at a doctor's clinic. Too much can be dangerous, too little can be dangerous. There has to be this happy medium in between in order to make sure that an amputation does not occur. If you believe that you suffered an amputation and it was due to the blood thinners that you were given, you need to speak to a medical malpractice lawyer who can tell you a little bit more about your rights. My name is Adam Funk. I am a medical malpractice lawyer. I'd be happy to chat with you about your case because I've handled tons of these types of cases.